So, hi everyone, we're back at it again. We have a really great lineup of individuals to talk to us today regarding Army and medical careers and medical opportunities that you may be looking for. Uh, I've got in our group chat today, we've got a group of three individual officers. We've got Captain Brandon Parham, we've got Captain Holly Weaver, and we've got Colonel Kevin McMains. And they're going to talk to you about opportunities that's out there. So I'd like to introduce the whole team, and here we go. Hi, team. How y'all doing?
Hey, good afternoon.
Hey, sir. How you
Hello.
doing? All
Doing
right. All
well, thank
right.
you.
Good deal. Good deal. So we've got a few folks already logged in to enjoy our discussion today. And what I'd like to go into first, and if you don't mind, sir, I'd like to go into a little bit about the opportunities that there are out there for physicians in the Army and the Army Reserve. And I'm going to have Captain Weaver and Captain Parham talk about it to essentially share to the viewers what these opportunities are all about. So I'm going to do a quick screen share with that slide. And here we go right here. So team, let me know when you're ready and we could go ahead and start going at it. First things first though, can you all three introduce yourselves?
All right, I will go first. My name is Captain Holly Weaver, and I'm an Army nurse. And currently, I work at the Kansas City Medical Recruiting Station for the Kansas City Medical Recruiting Company within the 5th Battalion. And I am in charge of all Army nurse recruiting as well as the physician recruiting in the Kansas City station area. So that's my intro.
All right, Captain Parham, what about yourself?
Good afternoon. I'm Captain Brandon Parham. I'm a Med Service Corps officer in the Army. Been in the Army for 16 years. I work out of the St. Louis Army Medical Recruiting Station and am the officer in charge there for the St. Louis physician team. Um, yeah.
Okay. All right, and Colonel McMains, go ahead and introduce yourself.
Sure thing, thanks. I'm Chris McMains. I'm an ear, nose, and throat doc down in San Antonio. I am employed as my day job through the VA and through a resource sharing agreement. Spend about half of my time over at Burke Army Medical Center. So do mostly sinus surgery, train residents, and do a bunch of faculty development to help myself and others teach better.
Okay, awesome, awesome, awesome. So, sir, the format that I'd like to go with moving forward is we've got about nine quick slides that Captain Parham and Captain Weaver can go through, and then afterwards, sir, if you don't mind, we could then go into and have Q&A and also discussions about that. That would be more to the end. We're gonna then have you start talking about what you do, what you're all about, and of course, if there are questions and comments coming in, we could always answer them during the discussion.
I'm at your service.
All right. Well, I appreciate that. All right. So, ma'am, Captain Weaver, go ahead. You're up.
All right, I just want to thank everyone out there who's tuning in, taking your time out of your day to learn about more opportunities as a physician in the Army and Army Reserve. So we thank you for watching. It's always an awesome opportunity to work with Otis in the 5th Medical Recruiting Battalion. So today we're going to be talking mainly about the Army Reserve, and so we're going to first talk about an overview of what the Army Reserve is. So Otis, if you want to go to the next slide, please.
Gotcha.
So the Army Reserve is truly a part-time supplement to your current career as a physician. And the obligation for, in general, for a physician or anyone serving a nurse or anyone that's in the Army Reserve, it's the 1 weekend a month and 2 weeks a year. So you're paid when you attend your drill, that's what it's called when you go do your reserve duty on that 1 week in a month, and then you're paid for the 2 weeks of training during the summer. What's really unique and different about the reserve deployments for physicians is that it's limited to 90 days where you're boots on the ground for your mobilization. One of the things that the Army Reserve recognizes is that we don't want you to be away from your practice and your patients and your family for very long. So, there's a much shorter rotation than an active duty rotation. And sometimes the mobilizations, they aren't necessarily deployments, but they might be actually going to work at your local military hospital to backfill a physician that's active duty that had to deploy. So there are many different opportunities for different types of mobilizations, whether humanitarian deployment or backfill, but a more common type of mobilization would be at one of the military treatment facilities. A really awesome YouTube video that gives a great idea of what potentially your summer training would be like in a medical unit in the reserve. I just put down there, it's if you type in on YouTube, Combat Support Hospital Mass Casualty MedX 12, there will be one that comes up and it highlights the Combat Support Hospital in Independence, Missouri. And it's just a quick few-minute video and focuses on how they would be setting up a combat support hospital in dealing with a mass casualty. And it was really a joint exercise. They worked with the Japanese government, and it's just a great look into what you might be doing during your training in the summer.
And so how about this, Holly? I'd like to have Colonel McMains, because I see you're biting at the bits there, sir. Do you want to jump in and maybe share maybe your experience regarding the slide that Captain Weaver just shared?
Well, I'm old and may have a hard time reading all of it. I guess what I can do is sort of speak my own experience, which is this, that so I've been both in on the reserve side and the guard side. I started out in the Army Reserve 2011 and joined the 1888 Head Neck Detachment up in Fort Lewis, Washington. And so, so my first several years were either doing kind of the required professional military education or going to drill with the 1888. And so that, I think, sort of followed the description that Captain Weaver gave pretty closely. On the guard side, and I switched over because I had the opportunity to be involved in a couple of special operations units, and those, again, Captain Weaver and Captain Parham, you can walk me back from this if I'm mistaken, but as my understanding is that there aren't any combat arms units actually in the reserve, on the reserve side. So like there aren't any medical billets in combat arms, and so that they were on the guard side. And so I played around, did that a little bit, and then have come back to the reserve side again now that I've kind of gotten the rest of that out of my system. So I don't know if that's the sort of narration you wanted, but that's so I've certainly experienced the sort of thing that is represented here, and very, very good experience. And I've kind of experienced some other things as well. And I'm happy to talk about it if folks want to talk about those too. Over.
Awesome. So I'm going to say if you're a viewer, if you've got questions, if you've got comments, feel free to share your comments, send in your questions. We've got an SME as far as the medical reserve, being a doctor in a reserve unit. And of course, we've got two medical recruiters, of course, here to answer your questions. But are you all fine with this slide? Do we want to move on to the next one?
Sounds great.
All right, let's jump on to the next one. Here we go.
All right, the first program that we want to talk about is the Specialized Training Assistance Program. And this program is specifically for residents. They have to be accepted into an accredited residency program. And we offer a monthly stipend of $2,200 while you're in residency, as well as student loan repayment up to $250,000, which is paid in $40,000 increments to the principal loan balance every year. And that can be received concurrently while also receiving the $2,200 stipend. So this program, essentially, what it's doing is it's providing a supplemental income. You can start receiving all of your reserve benefits as well. And you would not be doing any military training or having any type of where you have to go to drill or do any type of training until after you've completed your residency. So it's a pretty cool opportunity to supplement your income, because we know that residents don't make a lot of money. They will once they're done, but during residency, it's not much, and they really don't have much extra time. So the Army Reserve recognizes that, and as long as they are committed to serve once they're done with their residency, they'll owe 1 year for every 6 months that they receive the stipend. And that pretty much sums up what this slide is covering.
Okay, so
and Ollie, what I would like to add, what I like about this is that when you are commissioned in the strap, it starts your military time. So you are actually getting time toward your retirement while you're in residency and not drilling. And one big thing in the differences between the Army Reserve and the National Guard on this aspect is that the National Guard does make you drill as a resident while you're in residency.
Interesting. Sir, do you want to chime in on this?
I'm certainly not a subject matter expert, but I will say that one of my former trainees was a strap soldier and so received this throughout his residency, and so ironically he and I deployed at the exact same time. So we went through kind of the mobilization process together, and ran into one other a couple of times overseas as well. So I have some familiarity with this, and it was very, very good for him and his family. Obviously, actual mileage may vary, but it was good for him.
All right. Are we fine with this slide? Do we want to jump on to the next one?
Yep, you're good.
Okay, here we go.
So this slide is just outlining the qualifications for strap. Like I mentioned, you have to be accepted into a residency program. You obviously have needed to be graduated from an accredited medical school. If it's outside of the United States or Puerto Rico, have your ECFMG. And then we have to make sure the residency program is one of our on our critical war time list. So just making sure that it's an approved residency training program, and then U.S. citizen or a green card holder. And then there is potential that they could extend where they're not drilling or doing any obligation to the reserves if they get into a fellowship. But that is just kind of on a case basis, and it depends on the specialty. And if it's a specialty that we would support, that the Army needs for that fellowship.
Okay. All right. Anyone wants to chime in on this? Nope. All right. Let's jump on to the next one. We're getting you a little extra time, sir, for when it's your turn to to share your information. All right. Go ahead, Holly.
All right, so this program is similar in the fact that you are receiving a stipend and you're not having to do any commitment while you're in residency, but it's different in the sense that you're going to be an active duty doctor once you've completed your residency. So you're going to receive the $2,200 a month stipend while you're in residency on top of a $45,000 grant. That's the annual amount, and it's paid twice monthly. So between the stipend and the grant, it will supplement your income as a resident, $72,000. The obligation is slightly different. You owe 2 years for the first year, and then it's a year for year after that. But all the qualifications are the same. It is limited to less specialties, and those are listed on the slide. But for those that are thinking that they want to do the Army full-time, they're not wanting to open up their own practice, they're not wanting to pay for malpractice insurance, that kind of thing. They're wanting an adventure to travel and, to move and go different places. Then this would be the program for them.
Okay. That's excellent. Anyone wants to jump in?
Yeah, I'll jump in real quick. Otis. I'd say one thing that's really good about this is the fact that, similar with HPSP, but the fact that you can go from residency and go into the Army and practice your specialty specifically, instead of having to worry about the business side so much, which potentially could be overwhelming, dealing with the business side and trying to, further your specialty. With the Army, you don't have to worry about the malpractice. You don't have to worry about all that extra stuff. You learn your craft, and then as you're finished with your obligation, if you decided to, get out of the Army, then you get to learn the business side separately. So I think that's a really good benefit.
Okay, awesome. Hey, sir, you want to jump in?
I don't think I've got anything specific to say about the program itself, but I think I want to just follow on, if I could, on one of the comments that Parham made about kind of malpractice thing, and so there's something called the Federal Tort Claims Act, and so if somebody is acting as a medical practitioner in the service of the U.S. government, they cannot be sued directly. So they can be named in a lawsuit, but the lawsuit actually is they're suing the U.S. government. And so, depending on how people feel about that, and how nervous all that makes them, that can be a real bit of peace of mind. I was just on a phone call a couple of nights ago with a fellow I knew from residency, and he's unfortunately getting sued by somebody when he just basically got asked to come in and try to save the day, and no good deed goes unpunished, of course, and so he's now being named in a lawsuit. And and again, like that's it shouldn't be the driving focus or the driving force behind where and how somebody chooses to invest their medical career, but it is something to think about, and something to kind of try to be as honest with yourself about as you can as you're making the decisions about your practice setup. That may make a difference.
Okay, awesome. Thanks for the sharing, sir. Do we have anything else we want to add to this, team? Okay, let's jump into the next slide. And here we go.
So we're always looking for currently practicing physicians that have completed all of their residency and training. Your rank, will be based off of your experience and your education. So that will get calculated. And then we have, the student loan repayment opportunities up to $250,000. And I didn't list the bonuses because every different specialty has a different amount of bonus, depending on, if it's an internal medicine doctor or a general surgeon. Those amounts are going to be different, but the bonuses range from anywhere from $25,000 a year to $75,000 a year. In addition to, all the other benefits of being in the Army or the Army Reserve. So I just wanted to highlight, that we're not just looking for residents. We're always looking for those medical doctors and surgeons with experience, that have that call to serve.
So there's an opportunity where if you are a qualified practicing physician right now, you can join the reserve and you can reap the benefits from a financial benefit, from a benefit of being able to serve your country. But not only that, you're getting the opportunity to get training and experience that you may not have in the civilian side. So that's an absolutely wonderful thing. Sir, do you want to jump in on this?
I'd be happy to. I don't want to tell too much of my own story, but we'll just say in generalities that the further along that you go, medical student, resident, practicing physician, the more flexibility you have, and kind of the more, this, Captain Parham may not want me to say this, but the kind of the more control you have in kind of the conversation, and so I entered this conversation as somebody who had been practicing, out for 6 years, and so this is sort of the group that sort of applies most directly to my experience, and so. The whole thing about rank being based off of experience too. There's some formula about years in training plus years in practice. You can get what they call constructive credit towards rank. And so the first time I talked to the Army recruiter, they were going to offer me the rank of captain, and I was like, man, I've been at the VA, I've been training your captains and majors for the last 6 years, and so I waited them out until my time was such that they'd actually give me the rank of major to start with, and we kind of shook hands on that deal and called it good. So. Yeah, so I mean, really, I think it depends on the currency that you want to spend in terms of time or money, which is sort of more valuable to you, and so or control versus cash. That's a crass way to put it, and obviously there are a lot of other things that play in: family circumstance and personal values and patriotism and desire to serve. I mean, that list could be really, really long. But what I will say is just the further along that somebody completes on their own without the assistance of the Army, the more decisions that you'll get to make. I think you will have read from the last slide that there are if people got into the FEP program, they're limited on the residency types, and so if your heart's set on doing something else, I mean, I don't know, neurosurgery or dermatology or something, they're probably not critical wartime specialties, and so. That may mean that those particular programs don't apply to you, but the Army may still really have a place for you.
Excellent. Captain Parham, you want to jump in on this?
So I just want to say this is a candid conversation. We're not sugarcoating things here, so we're telling it how it is. Yeah. I think that's really. It's always best to just be truthful. Yeah, absolutely. I think this is definitely good, and like Lieutenant Colonel McMains said, it gives the opportunity to serve a different population. When I speak with physicians, especially those that have been practicing for 15, 20 years, are kind of looking to break out of what they're doing and find a specialized patient population that is new to them. So I think it's a good opportunity to just, like he said, kind of expand that and try something new.
Something I'd really like to highlight on this slide is that a lot of times, we'll be at conferences, we'll be talking to different populations of physicians and surgeons, and we get the answer, "Oh, I'm too old. My time has passed." And we're here to tell you that your time probably has not passed. And there are a lot of things that can be waived, especially for a physician and a surgeon. And, we have seen doctors in their 50s and even into their 60s serve in the Army Reserve. So, don't let your age be a limiting factor for you to inquire and find out more to see if you might be eligible, because the population that thinks they might be too old, they're at the point in their life where their kids might be in college now and they want to do it before it is too late, and they've always had that call to serve, but they have had many other things going on in their life, and now they're considering, like, I have to do it now or it's never going to happen. So I don't want anyone to think that, oh, I'm too old. Let us, figure that out and send it up, and we'll see if we can get that approved. And you never know, you could be, in your late 50s or something like that and get the opportunity to serve. So if it's something that interests you, don't let your age be a discriminating factor. Our experts at, our higher up commands, they'll be the determiner if that is a factor.
Absolutely, Holly. That's a great point. We get that all the time. Like, people walk up or send me emails all the time. "Oh, I'm too old," or "My time has passed." But we just had a 53-year-old family medicine physician accepted to join, and I also know a really great OBGYN who was 57. His son decided to go into the Air Force Academy, and he said, "I think it's my time to serve. It's something that I want to do as well." And he started the process and was also accepted. So it's a good point.
Awesome. Hey, sir, I saw you smile when some of the comments were brought up early. You wanna preview us as to why that big smile came on your face?
Sure. So I think within a couple of years after I commissioned, I had the good fortune to meet a gentleman who, he had spent 20, 25 years as teaching faculty at LSU Shreveport, and ended up joining the Army. And so he was commissioned as a lieutenant colonel and was telling me about how, and he's a basic officer leadership course with all the, the 20 somethings, there he is out there holding his own and all. And so just to say that, I think just to put a one human story on the principles that both captains were outlining.
Awesome. I think I actually was there at his commissioning ceremony. Colonel Rivera, she was the one who actually gave him the oath of office. That was a good experience down there in Shreveport area. But are we good with this slide? Do we want to jump on to the next one? Okay, we're good to go. Let's jump on to the next one. Here we go.
Okay, so I'm briefly going to talk about different opportunities that you could have as an Army physician, and then I will let Brandon and Colonel McMahons share, their experience. But, there are so many different opportunities that you could have being a physician in the Army or Army Reserve, whether it be, by leading soldiers, by providing medical care with coalition forces, furthering your education, helping teach and furthering, our medics and our nurses and our residents' educations, as well as humanitarian missions, and just the fact that you have the opportunity and the privilege to care for our warfighters.
Okay. Gentlemen, you want to jump in?
I was leaving some space for Captain Parham if he wanted to say anything about that. This is I just think really intensely personal. I don't think there's a right or wrong about this. And I think here's something else that I would just say is that I think probably when most people enter service, the reasons that they'd give are probably different from the ones that they'd give 5 or 10 years in. And that isn't bad or wrong, or it's not like, oh my gosh, you made a mistake. It's that they've come to kind of a different understanding of things, and maybe a different place in life, and maybe have been, touched by some of the experiences they've had. And so, the things that I would probably say about why I continue in uniform service are different. Not completely, different ball field, but the words would be somewhat different. And so when you kind of look over this, it kind of gives you a sense of some of the things that might draw somebody entirely appropriately. And, in 5 years in, maybe they've done some of that stuff and found that there are other aspects of it that are really kind of appealing to who they are. And so, at the at the risk of making this sort of a soft focus after school special, those are just a few thoughts about that.
I absolutely agree, sir. And one of the good things about the Army Reserve specifically is that Human Resources Command allows physicians and other specialties to apply for their humanitarian missions and things that they want to do that may fit their ideals, or things that are going on, things that happen around the world. So I think that's really cool. It's something that I learned. I had no idea that you could go and request specific quote unquote missions, if you will, to help out. Awesome.
So anyone else wants to share a comment or anything like that? Okay, let's jump into the next one. Here we go.
So, of course, we need to mention, the amazing benefits of just serving in the Army or Army Reserve. And one of the, the best financial benefits is having access to the Thrift Savings Plan, whether it be the traditional or the Roth. And one of the common misconceptions is that physicians or dentists or, providers, they think that they can't use the Roth because they make too much money. Because a traditional, a Roth IRA, they might make too much money. Well, this is a Roth retirement fund, so there is no income cap, and you can contribute whatever the maximum annual amount is, which I believe right now it's like $19,500 or something to that effect. So you have access to be able to use your thrift savings plan, and even if you only serve your initial obligation, you'll be able to continue to, you could roll that over into another retirement account, or you could continue to let that accrue until you're of retirement age. And then the DoD recently, within the last year or two, changed over the retirement system to the blended retirement system to give the service member more flexibility and options with retirement. And that includes a matching contribution up to 5%. In order to receive the 5%, you have to contribute 5% yourself. But that starts as soon as you start serving. And the nice thing about that is, if you just, once again, serve your initial obligation, you'll, be able to reap all the benefits of what the Army has contributed as well. And then that gives you more flexibility on, if you don't know if you plan to retire out of the Army Reserve and receive a pension, you have been accruing your contributions as well as the Army contributions the entire time that you've been in service. And like Brandon mentioned earlier, is that your time in service starts while you're in residency if you decided to do our STRAP or FAP program. And so you could immediately start your thrift savings plan, start contributing, and start getting that government match. Okay. And then if you do end up making a full career out of the reserve, there are the pension opportunities as well. And then one of the great, amazing benefits of the reserve is the low-cost health care. And I don't think that I've ever talked to anyone that complained about the premiums for TRICARE Reserve Select and the dental insurance. I looked up those figures on the TRICARE website yesterday to make sure that they were accurate. And, a folks that I've talked to, they have, children, that have different medical needs. And this would really help lift off a financial burden, with their medical care. And then as well, we've mentioned before the practicing physicians. And then once our residents are, drilling, got a unit and they're starting their obligation, then, they could be eligible for those bonuses.
Okay. All right. Captain Parham, you want to jump in on this?
I think all that's really great. And this is something that may not be a huge deal to everyone. And some of you may not have kids, but you also reap the benefits of the morale, welfare, and recreation. And as like I said, it may not. We went to Disneyland a couple of years ago, like 50% off tickets, which was awesome. If you're out at somewhere skiing, the ski lifts typically, or the ski resorts typically give you really good discounts. Which I think like Vail is $200 or $250 for a season pass, where it's usually $100 a day. Like I said, I know that's not a big deal. It is something a little extra, which I try to take advantage of, having a 13-year-old daughter. But yeah, I mean, there's another list of other things that come with military service.
Awesome. Hey, sir, I see the smile came back again. Jump in and share your points.
I was just thinking, it must be nice to be within driving distance of Vail,
When I was at Fort Carson, sir.
Straight down the block. I think probably the one thing that I'd say about this is that my guess is that most folks in medical school residency, probably thinking, got it. Wherever I'm going to work is going to get me covered for medical, and that's probably true to some degree. I don't think there are many self-respecting medical facilities that won't actually offer some medical insurance plan. What I can tell you is that it's worth actually looking into some of the details of some of this stuff too. In terms of, what's the deductible, and deductible meaning like the amount that you have to pay out of pocket before, any benefit at all starts kicking in. And those are actually, I think, the TRICARE Reserve Select compares very favorably to almost anything that I've kind of heard out, even on the civilian side. So just a point there. I happen to have a special needs daughter as well. And so, having steady insurance with a low deductible is a real blessing to my family. So.
Absolutely, absolutely. All right, let's jump into the next one. Oh, that's the question part. And luckily, we have some questions and comments coming in. But of course, Captain Weaver, you want to just share your point of contact that people could reach out to you? Of course, we have it scrolling on the bottom of the page as well, but you want to share anything else extra?
Absolutely. Just thank you again for helping set this up and giving us the platform and the opportunity to continue to share about all the amazing things with Army medicine and the opportunities to serve as a doctor in the Army or Army Reserve. But you can reach out to me through text or calling on my work cell, my
Mm-hmm.
email, or on Instagram. That is our station. It's Instagram or my professional Instagram, or on LinkedIn. If you're not within the Kansas City area, our battalion covers basically the entire Midwest. And, we will get you to the right person to talk to based
Mm-hmm.
off of where you're practicing and where you're located. But I know that, we want to also hear more from Colonel McMains and also get these questions going. So
Oh
that's
yeah,
all I
oh yeah.
have.
So absolutely. Well, we've got a few questions coming in. What do y'all want to do? You want to answer some of the questions, or do we want to jump right into Colonel McMains and then we answer the questions at the end? What do you want to do, team?
I think my bias would be to field the question, so there's this little flash bang time between when they're asking and when they get answered.
All right, too easy. Let's make it
Sounds
happen
good.
then. All right, so I will let me cancel the screen share so that we're not doing screen shares anymore. It's just four of us. And let's go into some of the comments first of all. We've got something from Son Voss said, "Hey STL team, how you doing STL out there?" We've got something from Mr. Lovett saying hello from Shawnee. And we've got some other teams, some other medical recruiting teams all over the nation. We've got one from the Vancouver station. How you doing, Sarah McDonald? How you doing? So here are some of the questions that's actually coming in. The first one, it asks, do both FAP and STRAP offer loan repayment options? Who wants to tackle that?
Brandon, do
I
you want
can,
it?
yeah, I can answer that. So FAP does not cover loan repayment specifically. The
Mm-hmm.
idea is that they're paying you the money to help you tackle those loans that you may have. Whereas STRAP goes directly to your financial institution, or sorry, STRAP goes directly to your financial institution to pay the balance down directly.
Okay. Thank you for the question, Mr. Jimenez. We've got something
Could,
coming in
could I
from
just could I just
YouTube.
ask a could I just
Oh,
ask
oh,
a follow on about that one?
go ahead, sir.
In terms of tax burden of those payments, like are both the payments that are made through FAP and STRAP dealt with similarly in terms of tax implications?
Yes, sir. The FAP is taxed directly as like income, whereas STRAP, when it comes to your stipend, is taxed also as income. However, the financial payments for your loan are taxed prior to them going to your financial institution to lower that burden a bit.
Okay, awesome. Did he answer your question, sir?
Yeah, absolutely. I think what I wanted to highlight was that whatever that number is, and I'm remembering 44,000, but I could be missing that. Like that it may not be that number gets knocked off of the balance of your loan repayment, because there will be federal taxes, state taxes, whatever is appropriate, taken out before it actually drops to the financial institution managing your loan. So just it's sort of expectation setting. So whatever tax bracket you are, and you kind of multiply by the appropriate factor, and that'll get deducted, and so the balance will then go towards loan repayment.
I'd like to just
Correct, sir.
quickly
That
piggyback. Oh, go ahead.
Sorry. So that I would say roughly equals out to 32 or 33,000 directly to your loan payment.
what I was going to quickly say about the student loan repayment, the Army offered a retention incentive to me a couple years ago to continue my service, and offered the student loan repayment. Same program, but I was already serving, so it was retention. And while it didn't completely pay off my student loan balance, it knocked it down so much that I was able to pay off my student loans within months, because then I was purely paying on principal, and just having all of my payment going, or almost all my payment going to principal, made me able to pay it off that much faster, when I really was not seeing a light at the end of the tunnel before that opportunity popped up.
Yeah.
So,
Yeah.
it is the government. They do have to take their taxes, but the amount, of reducing it so that the additional payments that you're making, they're going to be so much more significant in reducing that student loan debt. It's really going to help out.
Awesome. Okay. Sir, you want to jump in with anything? All right. Let's go ahead and jump into some more questions that I see coming in. We've got one from Miss Natalie Marie from YouTube. The question is, or the comment is, to make sure I am understanding correctly, speaking of wartime specialties, does that mean a residency space in strap or with an Army residency in something like orthopedic trauma would be more available?
I'll let Captain Parham take this one.
Not necessarily more available, I suppose. FAP is much more limited than what strap is, just based off of HPSP fills up a lot of our spots and what we need on the active duty side. So for FAP, they just decide what we need most. Whereas on the strap side, it goes anything that gets a bonus or any loan repayment, they're available. With the availability, that's going to be based completely on your application and how competitive you are to the other physicians that are applying for that program.
It looks like she had a little bit of a follow-up with that. She said, as opposed to something like primary care or OBGYN.
So with the primary care, OBGYN, orthopedic surgery, all those things, general surgery, emergency medicine, internal medicine, I would say those are the big ones that the Army uses when it comes to, their mobilizations and what they need most often based off of what the Army does. So
Okay.
does that answer? Does anyone have a?
So those both would be available in the strap.
Okay. And it looks like we've got a comment coming from Captain Olympio. How you doing, sir? He said, great job, Kansas City and St. Louis teams. We appreciate your word. So team, we had a really great information as far as reserve information from our recruiters, but the man of the moment is Colonel McMains. Yeah, that's you. It's you. It's you. So, sir, everyone is looking. Everyone wants to hear from you. Talk to us about how do you balance being an Army doctor and being in the reserve. Talk to us about what that's all about. And by the way, Captain Parham and Captain Weaver, I really appreciate the information that you shared with us. But we're going to give the man, Colonel McMains, the moment now to share his words.
Thank you.
Prepare to be underwhelmed. Yeah, thanks for that. So I guess let me give you a couple minutes sort of background. I went through college on a Navy ROTC scholarship, which I realize is anathema to folks in this uniform. I got an IRR commission when I got out. It was during the time that the Soviet Union had just fallen and they were trying to downsize the Navy. And so I had the opportunity then to take an IRR commission, which means individual ready reserve. So the idea is that you're still on the books, and if something bad like, COVID happened, that they could call you up. But that otherwise there weren't any specific military-related obligations. And so did that for 9.5 years, got through medical school, most of residency, ended up resigning my commission. And I did it over the initiation of the Gulf War. And I did that as sort of as a gesture of protest. I didn't think that it was right. I didn't think it was just. I didn't think it was ethical. So I resigned my commission. And so why do I tell you that? Like, again, that's probably not like hoo-ah, like go Army, right? So the reason I'm telling you that is that, fast forward 7 years, and I've been in civilian practice, finished residency fellowship, was on tenure track faculty at the Health Science Center in San Antonio. And at some point, it just got to the point where, like, well, one of my mentors and a retired Army Reserve colonel asked me if I would go with him on a mission trip, in effect, to Basra in Iraq in 2010 as a civilian, to teach and to operate. And, being there, and I don't know, again, how much history I need to dive into here, but kind of 06, 07, things were bad. There were a lot of assassinations of Iraqi doctors, that sort of you're taking care of my enemy. And so, the friend of my enemy is also my enemy kind of stuff, and a lot of kind of tribal badness. So real depletion of the human capital of the country. And so after I'd gone, I really, got to thinking, I'm like, man, I would really, if I could, like to help rebuild this country if I could, sort of we break it, we bought it, so, kind of idea. And so, the reason I share all that with you is that, at that point I started figuring out, okay, I think I want to get back in uniform. And so, for anybody who's listening, like, the reason I tell that story is because I don't want folks to think that they, it's only, people who are kind of super flag waving, or I don't know, whatever stereotype you might have, that you can find a place to contribute, find a place to give back and to serve, and there's a welcome for all political stances as well in the Army. So I ended up getting commissioned. At that point, I transitioned into about the same time that I started full-time work at the VA in San Antonio. I also got commissioned in the Army, and so have had sort of dual federal service, and that's actually worked really well. The VA kind of gets it in terms of military culture. So many of the people who work there are former military, and and so one of the great luxuries that I have is that my not only is my job protected by federal statute, which is true of anybody who works in any situation. So if I were still working on the civilian side. If I got deployed like I did in 2017, they would have to retain my job. Like it's a federal mandate that they retain your job. So in addition to that, I get additional paid military leave in addition to my annual leave from the VA, and so that's actually it makes it easier. And I think the question that was posed was how do you balance it?
Yeah.
And I think my best answer to that is that I've tried to build my civilian practice in such a way that it left enough bandwidth to do a credible job at both. I want to do an honorable job, my day job. I want to take great care of those patients, and both medically and surgically. I want to execute all the tasks that I need to in terms of education of next gen residents. And excuse me. At probably 6 or 7 years into my practice, I got to the point where clinically, I wasn't really improving with the same speed. And I think it's not because of laziness or lack of desire, but I think you just get pretty good at what you're doing. And I don't mean to beat my chest or pat my own back, but I think that you kind of get up to speed with what there is to know in your field. And so I found that I was really kind of casting around for how am I going to continue to grow? How am I going to continue to develop as a professional? And so, the Army has really been great for me for that. And again, that sounds like a recruiting statement, and fair enough if that's the way it sounds. But that's been true of me. It's the same retired Reserve Army colonel I was telling you about. He used to tell me that his Army service was kind of for him like the secret life of Walter Mitty. Like he had this sort of secret agent man identity that he had that really didn't talk to a lot of people about, and that kind of thing. And so that was it's sort of a fun element of that. And so Yes, I mean, I really try to prioritize my family. You know, I've particularly since coming back from deployment, have been separated from a while. I've really sort of looked for roles where I can meaningfully contribute and also professionally and also meaningfully contribute, you know, on the home front as well. And you know, I'm super thankful to my wife and daughter for putting up with that. So I'm going to stop there, and if there are redirections that that I need or other specific questions related to that, I'm happy to go deeper into any part of that story.
So no redirection from me personally. I allow whoever it is that comes on here be interviewed just share their information, and it's more natural that way, anyways. But does Captain Weaver or Captain Parham have any questions for Colonel McMains?
I don't have any questions. I just want to thank you so much, Colonel McMains, for your time and helping us make this a possibility. And you truly have a really unique and awesome story of different experiences serving. So you have a wide range of perspective and different experiences that you can share with others, which is really pretty unique and pretty awesome. So we thank you so much for your time and for hopping on here with us.
Yeah, thank you. I tell people I'm an inch deep and a mile wide, so hopefully it's useful. And I think I actually would, if I could take just a moment of personal privilege, I wanted to just thank Captain Parham. He helped me get back into the reserve from the guard side and really made that process a lot easier than otherwise would have been. And so I owe him a debt of gratitude and wanted to just say that publicly as well.
Captain Parham, shout out to you. Shout out to you.
Absolutely, sir. It was a pleasure working with you. I know the process wasn't exact, and it wasn't pretty throughout everything, but we got it all worked out, and I was happy to help out and make sure that you were taken care of.
Ooh, so we've got a question coming in, and maybe everyone could answer this question here. But the question comes from Mr. Anthony McMahon, and he asks, is the Army Reserve a good way to mitigate burnout in a sense?
Yeah, there are a lot of ways to answer that. And let me just take this stab. So one is burnout is, as anybody who's paying attention in either sort of formal peer-reviewed publications or in lay press will know that it's epidemic in medicine, and not just in medicine, but among doctors, nurses, physical therapists, occupational therapists, dentists, I mean, you name it. And so, the individual contributors to that are probably going to differ somewhat on a case-by-case basis, in terms of what people's values are, their desire for stress. Some people feel the need for speed, and all this, and other folks, want to take a slower, more thoughtful approach. And so in the same clinical environment, different people are going to respond differently. So, I don't know, 10 years ago, I took one of these personality, type indicators, and it was, when it was so like, what are your strengths or whatever. And so my number one thing out of the 30 that they did was like a love of learning. And so for me, the answer is yes, because it gives me all sorts of new stuff to learn about. And like I mentioned, new dimensions to grow. It may, for some people, be just another obligation. I would say also, I resonate with the mission of taking care of soldiers. I do that. Former soldiers and airmen, seamen, Marines, over at the VA side, and I feel that as an obligation to those that have done their service to the country, and also I like the opportunity to do that also in the reserve side. So I mean, when I put it in a nutshell, sort of the thing that I tell people off the cuff when people ask about the reserve is I say, I want to be doing good training or good service, ideally both. And as long as one or two of those things are still going on, then I'm still in. So how's that?
Excellent. That sounds great. Holly or Brandon, do y'all want to jump in? Oh, hold on. Let me fix that. Yeah, you good. Go ahead.
I would just kind of echo what Colonel McMains is saying. It is up to the individual on, what fills up their bucket. And I think that it would be a good way to switch up things. And, if you're looking for something, you can make the Army Reserve, an adventure. You can kind of stick to your 1 week in a month, 2 weeks a year. You can seek out those additional training opportunities. You can apply for those humanitarian deployments like Captain Parham had mentioned. So the opportunities are limitless. And I would say that, for people who have served in the past or maybe they're active duty, then, definitely the Army Reserve would be a great way to mitigate burnout.
Okay. What about you, Brandon?
Yep. And so I actually know why this question was asked, because we've talked to a few physicians and they have told us that the way they mitigate the burnout when it comes to this is doing the drill and going and just kind of hanging out for the weekend instead of, having to do the medicine or work at the hospital or work their 12-hour shifts or whatever. So I do think it's a great opportunity to be able to go and teach and mentor soldiers that are looking to take a similar path as the physicians or the nurses or the dentists or whatever the case is, and let them know their experiences, because a lot of times on weekends, that's what the physicians and the dentists and whoever else, the medical providers, do on their weekends. They teach those classes and mentor and make those contacts, networking, all of that stuff. So it's really great to be able to have somebody like that look up to you and have them see the path that you took as a physician, and idolize that.
Excellent. So I know we've been enjoying our discussion for it's almost an hour, and time has just kind of flown by. That's in a sense that you could tell the conversation is going good, and we really enjoyed ourselves. I hope that everyone, while they were watching our conversation, checked out the point of contact on the bottom of your screen. You check out Holly Weaver on LinkedIn. You give her a call or a text if you have some more questions or you want to ask about what options that you may be looking for. Her email is there as well. Her Instagram information is there as well. And of course, if you want a copy of the information that's being done, this is also going on YouTube, so you can check it out at a later time. But we've got one more comment, and I think the doctor is going to enjoy this comment coming here. The comment is, thank you all so much. This is coming from Natalie Marie. She says, thank you all so much, Dr. McMains. Will you host me for an ENT rotation during my 3rd year of med school?
Yeah, very, very kind of you to ask and be interested. What I can tell you is that I'm not in the position to make commitments about that. So interestingly, the training program that I work through or work with is the active duty ENT military program through Brooke Army Medical Center. So the academic wing of that is called San Antonio Uniform Services Health Education Consortium. So again, I don't know your circumstance, right? So if you are an HPSP, so Health Profession Scholarship Program soldier, then you may well be eligible to come down and do rotation. And I can put you in touch with a program director who was one of my residents when I was his program director, now 11, 12 years ago, and would be happy to help orchestrate that. If you're on the civilian side, then and do not have a military commitment already, then it may be trickier. That said, I'm also in close contact with the civilian folks down here in San Antonio. There's a civilian residency program at the University of Texas Health Science Center, San Antonio. And I know both the outgoing and the incoming program director there who might be able to help streamline that. Happy to talk about it more.
Yep.
Awesome.
Sir, just to touch on that real quick, she's actually one of my applicants. She's applying for HPSP. So fingers crossed, hoping that she gets accepted. She's been really awesome throughout the process, and has just been accepted to medical school in Monroe, Louisiana.
Congratulations. That's terrific. Good for you.
Congratulations.
All I'd say
Congrats.
is, keep in touch. With me, fine. I'm, happy to field email, but at least with Captain Parham, because he knows where to find me, track me down to do this. And so, so as that gets closer, then please reach out. Happy to help connect you with people who might be able to help you get to where you want to go.
Awesome. Well, I would say we've come to the end of our discussion. Anyone wants to add on anything last as we're moving out? How to reach out to you, how to contact you?
No, just thank you so much for everyone that participated and everyone that tuned in. And we appreciate all of the positive comments, feedback, and questions. It only helps us, provide better service to our future medical professionals that are going to be taking care of our warfighters. So thank you to everyone that tuned in.
Absolutely. Thank you. Brandon?
Definitely a second, Captain Weaver, and Otis. Thank you so much for setting this up and allowing us the opportunity to do this. Colonel McMains, you've been amazing. Thank you so much for doing this with us and providing your feedback and your experience. I know that it's been a long road, and you've had a lot of different experiences, and I'm glad that we're able to share that with our viewers.
I'm really sincerely honored by the opportunity. So thanks so much for making it happen.
All right, team. Well, I will talk to you all later, all right?
Bye. Thank you.
All right. And in parting, as I always say with every presentation, if you're looking for that point of contact, that contact information with Captain Weaver, her information is scrolling right there on the bottom of our page. Send her an email, send her a LinkedIn message, send her a phone call or a text. And even if she's not able to service you as far as your things that you're looking for, she can point you in the right direction to the appropriate recruiter that can help you out. So, in parting, as I always say, take care of yourself, take care of others, and take care of your family. Bye now.